The reason why it's really important to look at PrEP uptake and use in trans populations is that it's a group that honestly we've ignored both as researchers and as healthcare providers. It's a group that's vulnerable to HIV infection for a host of different reasons. When you're looking at trans women specifically, globally, trans women are almost 50 times more likely to become HIV infected. When you're thinking about transmasculine folks or trans men, we don't really have that much data, but Asa Radix had a really great talk earlier in the plenary that gave an estimate of HIV incidence in transmasculine folks of somewhere between 0 and 10%. Again, we don't know that much about transmasculine folks because we've been ignoring them in our studies, and so I think this study brings into light the fact that transmasculine folks are interested in using PrEP, they are using PrEP, and we need to better address that. The STRONG study was a validated cohort of transmasculine and transfeminine members of Kaiser Permanente. These are folks who had membership prior to 2015, and for this particular study we looked at folks who had active membership within Kaiser during the PrEP era, which was 2012 to March 2019. For our overall cohort, we looked at folks who had some kind of HIV risk indicator. These are folks who, during the study period between 2012 and 2019, had a positive bacterial STI, had a diagnosis code of HIV exposure or STI exposure, or had a diagnosis of anal wart. So for folks who had some kind of risk indicator, about 16% were linked to PrEP care. So a good number of folks who have what we would think are factors that would place them at a greater risk for HIV are not getting linked to PrEP care. So of those folks who had some risk factor who were linked to PrEP care, about 10%, so a really small number, actually started PrEP. But the bottom line is that we could be doing a much better job at linking folks to PrEP care, starting them on PrEP, and then retaining them on PrEP. We were surprised that a small majority, but still a good number of folks who started PrEP were transmasculine. And these are folks that we have traditionally not really thought of as being at risk for HIV, when in fact they might be, or they're interested in seeking these services. And actually, the seroconversions that we saw during the study period, a few of them were transmasculine folks, and folks were, based on chart review, we found that folks were reporting not only vaginal sex, but anal sex and other things that we would traditionally consider higher risk factors for HIV. Our data begs the question of what are we doing for transmasculine folks, and how are we reaching that population, and are we really assessing risk factors appropriately for that population?